1. Introduction. RAWSEP View. The United States government was on track in the Biden administration to reduce the prices for both clean energy heat pumps and clean energy electric cars. Trump tariffs are expected to upset those plans to prevent future air pollution and prevent climate change. The United States government should, instead of certifying wood stoves as safe when they are not safe, go forward with regulations that ban wood stove use and direct government money for use of forest refuse only. For home building and furniture building. For just a few examples of use of forest products for non-burning uses, it is well known from scientific and medical research that wood burning is a substantial source of PM 2.5 emissions, yet the wood burning industry uses the scientifically debunked theory named carbon neutrality of wood burning to argue that wood burning replacing coal burning in industry and in a trickle-down argument that wood burning should continue for home heating should continue. Presumably because it is called renewable. Wood may be renewable in the sense that a tree can be planted in the place of a cut-down burned tree, but it takes centuries or decades for the newly planted tree to attain the stature of the cut-down burned tree. During those centuries or decades, photosynthesis, which converts CO2 to oxygen and so sequesters some carbon, will not take place at the same rate as photosynthesis was performed previously, and wood burning emits both CO2 and PM 2.5, and PM 2.5 is not absorbed by trees, so PM 2.5 is not diminished by planting a tree in the place of a cut-down and burned tree. In fact, a living tree closes its pores against the presence of PM 2.5 from nearby wood burning, just as humans hold their breath in the presence of PM 2.5 from nearby wood burning. And when a tree closes its pores, the level of photosynthesis that absorbs CO2 pollution goes down. Wood burning emits 90% PM 2.5 particulate matter of 2.5 micrometer size, the perfect size to infiltrate the human lungs, setting off a cascade of human health problems and early deaths. Contrary to many beliefs, wood burning emits 2.8 times the PM 2.5 as the fossil fuel coal burning, and wood burning emits 450 times the PM 2.5 as the fossil fuel natural gas burning. Replacing coal burning with wood burning creates more air pollution in the form of CO2 and PM 2.5 than coal burning. This emission data comes from testing the cleanest burning wood stove in the United Kingdom, the Eco-Design Wood Stove and International Convention does not count the emissions from wood burning. The emissions from wood burning are erased from all countries around the world when calculating if each country has met its climate goals. This non-counting or erasure of wood burning emissions data from climate goals does not mean wood burning emissions do not exist. RAWSEP View. Purple air PM 2.5 monitors hanging from the eaves of the house of a near neighbor should be used to measure the level of PM 2.5 in the air hyperlocally in the yards of near neighbors of indoor residential wood burners. If PM 2.5 levels exceed World Health Organization standards of 5 micrograms per cubic meter annually, then that evidence of air pollution from wood burning should lead to the shutdown of that indoor residential wood burning appliance, one appliance at a time if necessary.
Hi, my name is Lily. Andrew gave you the intro to residents against wood smoke emission particulates and their concern for air pollution from indoor residential wood burning. Residents against wood smoke emission particulates, or RAWSEP, would like every near neighbor of an indoor residential wood burner whose wood smoke enters their yards and sickens the near neighbors to have a purple air PM 2.5 monitor hanging from the eaves of their home to measure the level of PM 2.5 entering their yards. That measurement of air pollution should be used as evidence of unnecessary air pollution, and each indoor residential wood burner should be shut down based on that evidence, one indoor residential wood burner at a time if necessary. The presentation by Andrew ended at 2 minutes 5 seconds. The same presentation by Emma starts at 2 minutes 3 seconds before the end of this podcast. So I am Lily, your timekeeper, and you can start the next podcast at 2 minutes 5 seconds in if you would not like to see the presentation by Andrew a second time. This presentation by me, Lily, ends at 5 minutes in. What you will see in the main content of this RAWSEP podcast will be news about air pollution from indoor residential wood burning and how that air pollution is being combated by ordinary people just like you who are unfortunately near neighbors of indoor residential wood burners at this time. There will also be news about unnecessary and highly polluting use of wood as fuel in industrial wood burners and preventable air pollution from wood burning wildfires. There will also be news about air pollution from PM 2.5 from gas-powered cars. There will also be news about airborne diseases which are also preventable with vaccines such as COVID-19 and measles and whooping cough, to name just a few. In 2025, residents against wood smoke emission particulates is also concerned with combating the Trump destruction of government funding for programs which protect human health through the Department of Health and Human Services, and Trump destruction of programs which fund the science and medical research plan to protect human health from preventable illnesses. Protecting human health is a patriotic act, and our defense against enemies is weakened if we are not as healthy as we can be. Heat pump rebates are now offered by the federal government, distributed through the eligible United States, are available in 2025 and are the best, cleanest, and now cheapest alternative to indoor residential wood burning if that burning is actually done to purportedly save money. Wind and solar as sources of the electricity that powers heat pumps and electric cars is also cheaper than burning wood. The adverse health effects that are caused by indoor residential wood burning also come at a cost to near neighbors, both in shortening and ending their lives and in actual hospital, clinic, and funeral costs. Instead of being compensated monetarily, near neighbors should instead be able to achieve immediate relief by stopping indoor residential wood burning in their hyper-localized neighborhoods, which relief readings from purple air PM 2.5 monitors used as evidence of air pollution will help them achieve. Welcome to news about hopeful scientific and medical achievements that will also help us achieve the goal of clean air to breathe.
Webisode 57DHYAA, December 4th, 2025, the RFK Junior Methodical 20-year quest to dismantle vaccine policy. In Webisode 57DHYAA 0 RAWSEP View of RFK Jr. and his quest to deny life-saving vaccines to all and focusing right now on denying vaccines to newborn babies, 1. The RFK Junior Methodical 2-decade quest to dismantle vaccine policy. The health secretary has walled himself off from government scientists and empowered fellow activists to pursue his vaccine agenda. 2. Vaccine advisory. Panel again postpones vote on Hepatitis B Shot for newborns. RAWSEP View. It seems the vote may only be postponed until Friday. Main content. 0 RAWSEP View. If you are not paying attention, you may not notice that greed for money is driving RFK Jr. to deny vaccines to all, and especially at this time driving RFK Jr. to deny vaccines to newborn babies. For years, RFK Jr. made his living by joining in baseless lawsuits against vaccine providers, as we have seen with Trump and his baseless lawsuit threats against research universities, who often research and find cures for many forms of cancer using wealth. To go after innocent plaintiffs can serve as extortion against those who do not have the money to continue to defend themselves in court. Endlessly monetary settlement because of harassment in court is not what we think of when we think of legal justice, but those who win in court congratulate themselves that they made the investment of their wealth in baseless lawsuits and indeed walked away from court with some unearned monetary prizes. RFK Jr. and Trump have much in common in that regard. It is enough to make a person turn away from the news that only gets worse as more extortion of scientists and medical professionals creates rot in the very heart of our previously exemplary government services. Envied the world over. RFK Jr. may also feel that his weak intellect is bolstered by what he dimly must think are the cleverness of arguments that are made to deny vaccines to everyone, but especially to newborn babies. Facts to bolster his arguments are not there, but the idiotic search is on, even if it has been on for 25 years, to link vaccines to autism. The facade completely covers the idiocy in the RFK Jr. view. Apparently, like Trump, he has never had to look himself in the mirror objectively since both were born with a silver spoon in their mouths. Any other person would be dismissed as the pathetic, feeble-minded wreck, which is how RFK Jr. presents himself. Maybe that has helped him win in courtroom appearances, but the wins are probably all from the wealth expended on cases and on his name recognition. How horrible for a 35-year-old second cousin of his that has terminal cancer to see that she will probably predecease RFK Jr., and she will also probably die knowing that he will cause the unnecessary deaths of so many Americans with his greed and stupidity. One can only hope that on Friday this confederacy of dunces assembled will miraculously not vote to deny life and health-saving vaccines to newborn babies on one side, which is the side of outside agencies and doctors outside the committee now, is on the side of science and rationality and evidence-based decision making. The other side, which is on the side of the committee, is on the side of greed, led by lawyers like Speaker Aaron Syria, lawyer who for years joined with RFK Jr. in court battles over vaccines. Will U.S. Senator and Dr. Bill Cassidy, the weak-minded physician who weekly offered the deciding vote on RFK Jr., be listened to at this late date, as Cassidy realizes conveniently 11 months too late that this Kennedy is a loser? How could someone who is not a physician and someone who could not understand science and therefore rejects it be appointed to this position? Only if the appointer is a 34-count felon who is escalating his attacks on the American public in general. As the months go on, this situation is alternately boring and stupid, as are the two principal offenders. We must pay attention to this. But how much damage will be done to our formerly prosperous and envied nation? For those thinking about affordability, how much of our taxpayer money has been and will be expended propping up this do nothing for the average American government? Will Republicans continue to sit on their hands as we are robbed by Trump and decimated by RFK Jr.? Dr. Cody Meissner, a professor of pediatrics at Dartmouth Geisel School of Medicine, is widely considered to be the most qualified member of the committee, but his arguments are so rational they will probably not sway the rest of the committee. One can only hope. 1. The RFK Jr. Methodical 2-decade quest to dismantle vaccine policy. The health secretary has walled himself off from government scientists and empowered fellow activists to pursue his vaccine agenda. Excerpts edited for brevity and clarity in relationship to residents against wood smoke emission particulates. A 501c3 nonprofit organization. The New York Times, December 4th, 2025. An examination of the RFK Jr. tenure atop the massive health agency of the nation shows how in ways not previously known he has methodically laid the groundwork to overhaul American vaccine policy. The RFK Jr. efforts will be on full display Thursday and Friday, when a panel of vaccine advisors handpicked by the health secretary after he fired the old group meets to reconsider the suite of vaccines given to young children. Unraveling the vaccine schedule would mark a radical, and experts say, dangerous shift. Public health officials warn that the RFK Jr. succeeds, measles and other infectious diseases will come roaring back, jeopardizing the health of all American children. 6 medical organizations have taken RFK Jr. to court, accusing him of a clear pattern of hostility toward established scientific processes that has resulted in chaos throughout the healthcare system. The federal government does not mandate vaccination. That is up to states, but the CDC recommendations provide a guide to state lawmakers and parents and help dictate which vaccines insurance companies will cover. As secretary, the RFK Jr. controls billions of dollars in vaccine funding for low-income children. He has already threatened to withhold money from states that do not allow parents to opt out of vaccine requirements. His ultimate power is the bully pulpit. He can shake confidence in vaccination or reinforce it. This account is based on interviews with more than 24 people, including current and former government scientists. Activists and allies of RFK Jr. reporters also reviewed internal emails and interviewed RFK Jr. twice. While much of the RFK Jr. work has been out in the open, the review shed light on what he has done behind the scenes. When a child died of measles in Texas just 2 weeks after the RFK Jr. took over, longtime CDC infectious disease experts sought unsuccessfully to brief him. Instead, RFK Jr. consulted a doctor he met through the leader of the nonprofit he founded promoting his alternative treatments while downplaying vaccination. When the RFK Jr. wanted to learn about vaccines for malaria, he turned to a doctor who had worked with him on a petition in May 2021 asking the government to withdraw COVID vaccines vaccines from the market in the thick of the pandemic, she advised him against investing in malaria vaccines, and he has enlisted a career CDC scientist who questioned the validity of a 2004 study that concluded the measles vaccine was not linked to autism. Rejected by the CDC, but he remained at the agency under government whistleblower protections, working quietly in its division of viral hepatitis until RFK Jr. arrived and began consulting him about vaccines and autism. RFK Jr. is particularly interested in having us examine isolated autism cases from decades-old data. RFK Jr. personally directed the CDC to abandon its official position that vaccines do not cause autism. Within the past week, he has installed critics of COVID vaccines as the no-2 official at CDC and is chairman of the panel of vaccine advisors, but he rejected the idea that vaccines have been his main focus. Coronavirus vaccines became harder to get after he announced new guidelines on social media, and May, sidestepping the usual scientific review process for what he called a common sense change. The vaccines are now approved for people older than 65 and those with underlying medical conditions. RFK Jr. canceled a nearly $600 million contract with Moderna, the COVID-19 vaccine manufacturer that was working on an mRNA vaccine against bird flu for humans. He also cut nearly $500 million in grants and contracts to develop mRNA vaccines. His critics say the cuts will diminish a promising new method to deliver vaccines and cancer treatments for the first time since the CDC, founding nearly 80 years ago. States are no longer listening to its advice. Democratic-led states have formed their own coalitions to issue vaccine recommendations. 92% of Democrats say the benefits of the measles, mumps, and rubella vaccine outweigh the risks, but just 78% of Republicans feel that way, down from 91% a decade ago. A new study RFK Jr. shot back shows the opposite, that vaccines cause autism. The study associated with vaccine skeptics had been faulted as biased and flawed. RFK Jr. spent the first part of his career as an environmental lawyer and worked to eliminate mercury from waterways since the early 2000s as chairman of the so-called Health Defense of Children, the nonprofit. He ran until he launched a bid for the presidency in 2023. RFK Jr. tried to build a case that vaccines were more hazardous and infectious diseases less dangerous than most people believed. Measles outbreaks, RFK Jr. wrote in 2021 in an ebook published by his nonprofit, have been fabricated to create fear that in turn forces government officials to do something 2 weeks after senators voted narrowly to confirm him. RFK Jr. had his own measles outbreak to confront the disease was spreading in the tiny West Texas city of Seminole, home to a close-knit community of Mennonite Christians who shun vaccination. An unvaccinated 6-year-old girl became the first person on American soil in a decade to die from measles. Two top officials, Dr. Deborah Oury, the CDC chief medical officer, and Dr. Demetra Daskalakis, the CDC top infectious disease expert, each said that they had appealed to the RFK Jr. staff to allow them to brief the secretary on the crisis brewing in Texas. But the briefing never happened. Dr. Oury, the CDC chief medical officer, said the top aides of RFK Jr. demanded that she update the agency website to reflect anti-vaccine advice. RFK Jr. also sent CDC epidemiologists who typically respond to outbreaks to the area and ordered the shipment of 2,000 measles vaccines, even as he insisted in a Fox News opinion piece that the decision to vaccinate is a personal one. Health secretaries have routinely promoted vaccines, especially during outbreaks. Dr. Layla Myrick, a local physician, said about alternative treatments offered instead of medical intervention, "It was infuriating," she said, "because we have our hospital right here." Even more frustrating for Dr. Myrick and other mainstream doctors was the way RFK Jr. contradicted Texas health officials and downplayed the danger of measles. State health authorities said the first death was from measles and a second death in a school-age child was from measles pulmonary failure. RFK Jr. has since managed to assemble more stalwart allies from his past vaccine crusades and put them in the health department and its various agencies, including the CDC. When asked during a Senate hearing in September to name scientists inside the CDC who have briefed him, the RFK Jr. mentioned only one, Dr. Thompson, the CDC whistleblower. This spring, emails show Dr. Thompson was deeply involved in trying to obtain data for autism research. RFK Jr. also hired Mark Blaxill, a businessman and longtime advocate for parents of children with autism, who has argued that the CDC is committing fraud by concealing a connection between vaccines and autism. He was assigned to work with the new committee of vaccine advisors that will discuss this week whether the schedule of vaccines given to infants and toddlers should be revised. When the new panel convened for the first time in June, the agenda included thimerosal, the mercury-based vaccine preservative that RFK Jr. and many in his movement had long viewed as a potential cause of autism. It had been removed from nearly all childhood vaccines, but not flu vaccines in the early 2000s, not for safety reasons, officials said at the time, but to assuage the concerns of parents in preparation for the session. Dr. Daskalakis, the CDC top infectious disease expert, said he asked agency scientists to assess the benefits and risks of thimerosal. Their 17-page report showed that while thimerosal and vaccines given to pregnant women had fallen steadily, autism rates were still rising, suggesting that the preservative was not to blame. The CDC posted the report on its website the night before the meeting, but during the meeting it suddenly disappeared. RFK Jr. said in the interview that he was not aware of the document. In the end, the vaccine advisors called for pregnant women and children to avoid flu vaccines with thimerosal, a recommendation that mainstream scientists said was not rooted in evidence. It was a victory for the health secretary and his supporters, but it also brought simmering tension between the RFK Jr. team and career CDC leaders closer to a boiling point. Dr. Jernigan, Dr. Daskalakis, and Dr. Oury were called into the offices of agency lawyers to explain how the document was created and posted the holy grail vaccine data over 31 years at the CDC. Dr. Jernigan had led the response to dozens of disease crises around the globe. He set up testing when a deadly bird flu was killing vendors from Bangladeshi bird markets in 2012 and responded as the Ebola virus ripped through a maternity hospital in Sierra Leone in 2015. None of that, he said, had prepared him for the uncomfortable assignment he would face in the spring of 2025, opening up the vaccine safety data link to David Geyer, the man RFK Jr. chose to examine decades old medical records. Dr. Jernigan, since that his job was on the line in August, his Postpones. Suspicions were confirmed. RFK Jr. demanded that Susan Menarez, the CDC director who had been on the job for less than a month, fire career officials responsible for vaccine policy and accept policy changes. Without question, she refused, she said, and was fired the next day. Dr. Jernigan, Dr. Oury, and Dr. Daskalakis resigned. RFK Jr. vowed, was determined to pour money into vaccine safety. Studies that have never been done. He remains convinced that vaccines, along with ultra-processed foods and environmental toxins, have fueled an increase in asthma, allergies, autism, and other neurodevelopmental disorders that have been on the rise in recent decades. When the number of childhood immunizations rose, there is no scientific proof, but RFK Jr. is on a mission to change that. Vaccines, he said, must be a potential culprit because they became ubiquitous along that timeline. RAWSEP View and podcasts also became ubiquitous along that timeline, and electric cars also became ubiquitous along that timeline, and life-saving drugs against cancer became ubiquitous along that timeline, and autism has probably always existed and has only become known better because of increased testing. 2. Vaccine Advisory Panel again postpones vote on Hepatitis B Shot for Newborns RAWSEP View. It seems the vote may only be postponed until Friday after heated disagreements. The committee members appointed by Health Secretary RFK Jr. delayed the vote until Friday morning. It was the third time the vote had been postponed. Members of the Advisory Committee on Immunization Practices may decide to end the recommendation that babies get immunized against hepatitis B. Excerpts edited for brevity and clarity in relationship to residents against with smoke. Emission Particulates, a 501c3 nonprofit organization, The New York Times, December 4, 2025. Accusations that presenters were cherry-picking data and relying on speculation over science derailed a federal vaccine advisory panel vote on Thursday on whether to change a decades-long recommendation that all newborns be immunized at birth against hepatitis B. The committee deferred the vote to Friday because some members wanted more time to settle points of heated disagreement. The panel had postponed the vote twice before for similar reasons. At one point in the Thursday meeting, Dr. Jason Goldman, a liaison to the committee from the American College of Physicians, angrily told the panelists that they were promoting this anti-vaccine agenda without the data and evidence necessary to make those informed decisions. Do what is right, Dr. Goldman told them, adding that the people chosen to present data to the committee did not have the data-driven background to make those presentations. The members of the panel, the Advisory Committee on Immunization Practices, or ACIP, were handpicked by Health Secretary RFK Jr. after he fired all 17 of the original panelists. The committee is charged with shaping the vaccine policy of the nation. RFK Jr. has frequently said that children get too many vaccines and too many at the same time, and he has tasked the newly appointed committee with reviewing the safety and need for vaccines included in the childhood vaccine schedule, including the hepatitis B shot. But so far, the meetings of the panel have been distinguished by a level of turmoil, divisiveness, and dysfunction unknown to the state. Mostly routine gatherings the panel held in the past. Tempers have flared. Insults have been traded. At the September meeting, a hot microphone caught one panelist calling another committee member an idiot, and the committee members have been sharply divided on the relative benefits and risks of the vaccines they are tasked with discussing. On Thursday, outside experts castigated the disorder of the meeting and what they saw as an inappropriate focus on the theoretical harm of vaccines over proven benefits. Today made clear that the members of this committee are more interested in sowing fear than advancing vaccine policy, said Dr. Jose Romero, a member of the American Academy of Pediatrics Committee on Infectious Diseases. Parents deserve clarity. What they got was chaos. He added the committee members were charged with making a decision based on the effectiveness of the hepatitis B vaccine, its contribution to reducing infections, and its safety. The first shot is given within 24 hours after birth to prevent infection with hepatitis B, a highly contagious virus that can cause severe liver damage. But the format of the meeting broke with tradition in multiple ways. The agenda did not list speakers until the morning of the meeting or reveal the names of the working group for hepatitis B until pressured to do so during the meeting, and given the importance of their decisions, the members were sharply criticized by outside experts for not using the established evidence to recommendations format, which typically entails detailed presentations on effectiveness, feasibility, cost-benefit ratio, and equity, instead of a Centers for Disease Control and Prevention scientist speaking. Cynthia Neveson, a climate researcher at the University of Colorado, presented data on trends in disease prevalence. Dr. Neveson is a former board member of Safe Minds, an organization that supports the false theory that vaccines cause autism. Mark Blaxill, a well-known anti-vaccine activist and self-described critic of the CDC, who is now a staff member at the agency, presented data on the safety of the hepatitis B vaccine, pulling from studies that included papers published by David Geyer, a discredited researcher and outspoken vaccine critic. The agenda for Friday, when the committee is scheduled to take up broader issues about the childhood vaccine schedule, lists as a speaker Aaron Siri, a lawyer who for years joined with RFK Jr. in court battles over vaccines, but Senator Bill Cassidy, Republican of Louisiana, and a gastroenterologist, noted on Thursday in a social media post that Siri was not an expert on childhood vaccines. Aaron Siri is a trial attorney who makes his living suing vaccine manufacturers. Cassidy wrote, "The ASIP is totally discredited," he added, referring to the vaccine committee. "They are not protecting children. The decisions of the committee are not legally binding, but they have significant implications for whether private insurance and government assistance programs are required to cover the vaccines." Remarks before the meeting by committee members Trump and RFK Jr. had suggested that the committee was likely to vote in favor of delaying the vaccine for babies born to mothers who tested negative for hepatitis B. Dr. Kirk Milhoan, the newly appointed chair of the panel, also indicated earlier in the week that the members would most likely recommend against universal vaccination at birth and instead recommend delaying vaccination for most babies until they are older. The conversation grew most heated after Blaxill presented data that he said suggested the vaccines were harmful. Dr. Hibble asked for any solid and reproducible evidence of harm from the vaccine. When Blaxill responded that there was limited evidence of harm, Dr. Hiblin snapped back, "So speculation and limited evidence? Got it." Many public health experts are concerned about the hepatitis B vote because children are especially vulnerable to the virus. More than 90% of infants who are infected develop chronic hepatitis B, which can lead to cirrhosis, liver failure, and liver cancer, compared with less than 5% of people who are infected as adults. Each year in the United States, more than 17,000 infants are born to women who have hepatitis B, but nearly 1 in 5 pregnant women are not tested for the virus, and only about 1 in 3 women who test positive receive care, according to a report released on Tuesday by the Vaccine Integrity Project, an initiative dedicated to safeguarding vaccine use in the United States. Congenital syphilis, another infectious disease for which pregnant women are screened, offers a comparison. Denmark had no cases of congenital syphilis in 2023. The United States had nearly 4,000 cases. In her presentation, Dr. Nevison contended that it was not the birth dose of the hepatitis B vaccine that had brought down cases of the virus. It is the more targeted measures that have had the biggest effect in bringing down cases of hepatitis B. She said the targeted measures are working. Attributed the decline to better screening of blood products, safe sex practices, and needle exchange programs. But hepatitis B experts and pediatricians, including some of the members of the committee, questioned the source of the data and strongly disagreed with her interpretations. This disease has gone down in the United States thanks to the effectiveness of our current immunization program, said Dr. Cody Meissner, a professor of pediatrics at Dartmouth Geisel School of Medicine, who is widely considered to be the most qualified member of the committee. When Dr. Robert Malone, the vice chair of the committee, who led the discussion, said Dr. Meissner was opining, Dr. Meissner retorted, "These are facts." Dr. Nevison said during her presentation that the risk transmission of the virus by other methods besides maternal transmission was overblown. Only children living among Vietnamese immigrants and Hmong refugees are in significant danger of being exposed to the virus, and so need the birth dose of the vaccine. Shari Cohen, president of the Hepatitis B Foundation, this is not just a problem among immigrants or communities of color. She said it is a virus that can affect all Americans. As many as 70% of the roughly 2 million Americans with hepatitis B are unaware of their diagnosis. Dr. Cohen said RFK Junior has long questioned the safety of the hepatitis B vaccine and claimed incorrectly that it was not tested properly. He has also said without evidence that the vaccine causes autism, and he has upbraided the CDC for recommending universal vaccination at birth.
Red-green fox here. The quick red-green fox jumped over the barriers to clean air. Red-green fox here. Ready to sing to you the names of the 2025 major wood-burning biomass industry subsidy opponents. 1. Biofuel Watch. 2. Bulkley Valley Stewardship Coalition of British Columbia, Canada. 3. Kommite Schöne Luft, which means Beautiful Air Committee in German. 4. Dogwood Alliance. 5. Equity Group Foundation, nicknamed EGF. 6. Environmental Paper Network, nicknamed EPN. 7. Natural Resources Defense Council, nicknamed NRDC. 8. Prakaunia Narzek Wisistki Istit, which means Workshop for All Beings in Polish. 9. Rachel Carson Council. 10. Solutions for Our Climate, nicknamed SFOC.
Cat's corner strategy with Tiger and Leone. Saying the quiet part out loud. Roar. Hi, I am Tiger. Our human asked us to get up from our naps and start Cat's Corner strategy with Tiger and Leone. She gave us a list of internet allies, which we will post for her here.
Hi, I am Leone. It is better for your mental fitness to go to these websites than to go to bro sites for advice. Substack letters from an American Heather Cox Richardson. Substack your local epidemiologist. The Midas Touch. The Guardian. The New York Times.
One introduction. RAWSEP View. The United States government was on track in the Biden administration to reduce the prices for both clean energy heat pumps and clean energy electric cars. Trump tariffs are expected to upset those plans to prevent future air pollution and prevent climate change. The United States government should, instead of certifying wood stoves as safe when they are not safe, go forward with regulations that ban wood stove use and direct government money for use of forest refuse only for home building and furniture building. For just a few examples of use of forest products for non-burning uses, it is well known from scientific and medical research that wood burning is a substantial source of PM 2.5 emissions, yet the wood burning industry uses the scientifically debunked theory named carbon neutrality of wood burning to argue that wood burning replacing coal burning in industry, and in a trickle-down argument that wood burning should continue for home heating should continue. Presumably because it is called renewable, wood may be renewable in the sense that a tree can be planted in the place of a cut-down burned tree. But it takes centuries or decades for the newly planted tree to attain the stature of the cut-down burned tree. During those centuries or decades, photosynthesis, which converts CO2 to oxygen, and so sequesters some carbon, will not take place at the same rate as photosynthesis was performed previously, and wood burning emits both CO2 and PM 2.5, and PM 2.5 is not absorbed by trees, so PM 2.5 is not diminished by planting a tree in the place of a cut-down and burned tree. In fact, a living tree closes its pores against the presence of PM 2.5 from nearby wood burning, just as humans hold their breath in the presence of PM 2.5 from nearby wood burning. And when a tree closes its pores, the level of photosynthesis that absorbs CO2 pollution goes down. Wood burning emits 90% PM 2.5 particulate matter of 2.5 micrometer size, the perfect size to infiltrate the human lung, setting off a cascade of human health problems and early deaths. Contrary to many beliefs, wood burning emits 2.8 times the PM 2.5 as the fossil fuel coal burning, and wood burning emits 450 times the PM 2.5 as the fossil fuel natural gas burning. Replacing coal burning with wood burning creates more air pollution in the form of CO2 and PM 2.5 than coal burning. This emission data comes from testing the cleanest burning wood stove in the United Kingdom, the Eco Design Wood Stove International. Convention does not count the emissions from wood burning. The emissions from wood burning are erased from all countries around the world when calculating if each country has met its climate goals. This non-counting or erasure of wood burning emissions data from climate goals does not mean wood burning emissions do not exist. RAWSEP View Purple Air PM 2.5 monitors hanging from the eaves of the house of a near neighbor should be used to measure the level of PM 2.5 in the air hyperlocally in the yards of near neighbors of indoor residential wood burners. If PM 2.5 levels exceed World Health Organization standards of 5 micrograms per cubic meter annually, then that evidence of air pollution from wood burning should lead to the shutdown of that indoor residential wood burning appliance, one appliance at a time if necessary.